Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Good afternoon. Jeremy Hunt has been accused of being completely out of touch with the scale of the problems facing the NHS as he refused to accept claims from the Red Cross that the health service is facing a humanitarian crisis.
Well, Dr Mark Holland from the Society for Acute Medicine said he was in disbelief at the Health Secretary's claims that hospitals were performing slightly better than last year. But Jeremy Hunt did admit to Sky's Adam Bolton that the NHS was facing real problems.
I don't accept it. You probably expect me to say that, but I think it's worth looking at what independent people are saying about that. So Chris Hobson, who represents all the NHS hospitals, no friend of the government when it comes to NHS policy in a number of areas, he has said that it's overblown and that actually the vast majority of hospitals are coping, if anything, slightly better than last year. But we have got a few where there are some real problems, places like Worcestershire, and we are working night and day to try and turn things around.
Are people dying on trolleys? Are people being discharged at 3 in the morning from hospitals?
Well, all these incidents are being investigated, but it may be the case that we are having some real problems, and I'm afraid you do have tragedies in a huge organisation like the NHS, and I've tried to do a lot in my time as Health Secretary to improve the levels of safety. But I think, in the case of Worcestershire, for example, we've put it into special measures. The Chief Executive's gone. We've got a new Chief Executive actually recruited from Australia who's going to be starting in the spring. So a lot of things are being done. And I think what we want with the NHS, we have some of the best care in the world in some of our hospitals, some of the cancer care, some of the mental health provision, some of the emergency care is bloody brilliant.
It's patchy though, isn't it?
It's brilliant, but it's patchy, as you say, and what we want is to have that same high quality care across the whole system.
Get a grip, Jeremy, or go to Theresa May and say we need some money. The 700 million is going to be allocated to social care in 2019. Bring that money forward today and get Theresa May to agree that in the next few days that we'll put in place a proper financial settlement for the NHS and social care going forward. We cannot have a winter like this.
Let's bring in our political editor, Faisal Islam, who was listening to Theresa May's speech an hour or so ago. Faisal, good afternoon to you. Spare a thought, I suppose, for the staff at Downing Street. They know when they look at their calendar that at some point in the winter, because history tells us this, there will be a NHS funding crisis story.
Yes, they will, obviously, because of an ageing society, because of the nature of illness in our society. It's always going to be more pressured over the winter period, over the New Year period too. But the fundamental argument now is to whether this is a sort of natural phenomenon that we should expect in the NHS or whether it's something that's emerged over the past 5 or 6 years. That's the argument of the opposition, as you heard from the Shadow Health Secretary, John Ashworth there. Indeed, the Prime Minister, when asked about this today, reiterated what she told Sky News as Sophie Ridge yesterday, saying that to some degree you expect this. She used the phrase today, it's not unusual to have this type of winter pressure. She and Jeremy Hunt are admitting that there are significant pressures on parts of the NHS. What they're not saying is what the Red Cross have argued is that there's some sort of humanitarian crisis. Theresa May today, the Prime Minister, spelling out her vision of social reform, focusing not on the health service generally, but on mental health. This was her approach in a speech she gave just an hour ago.
Today I want us to forge a new approach, recognising our responsibility to each other and make mental illness an everyday concern for all of us and in every one of our institutions. What I'm announcing are the first steps in our plan to transform the way we deal with mental health problems at every stage of a person's life, not in our hospitals, but in our classrooms, at work and in our communities.
Yeah. Faisal, in terms of that speech, it wasn't just about the health service. She made it pretty clear this was the first instalment, really, that will help flesh out what Theresa May stands for politically.
yes, it was the Theresa May kind of philosophical tract. It was an extension of the speech that she gave in Downing Street when she became Prime Minister. She extended upon the idea of there being burning injustices, which the political system based in Westminster had ignored over a period of years, that some of that is about people left behind from globalisation, that the outright injustices had been focused on by the press and by the political system, but everyday injustices affecting working class families had been ignored. An example of that would be what she says is the impact of migration on wages. She says that all of that has to be addressed, and if it's not addressed by someone of the centre, centrist mainstream politician like herself, she warned that the far right and the far left would pick up the mantle and would address these concerns and would drive politics to the extreme. So an intriguing speech. She was a dividing line with Margaret Thatcher, who famously said in a woman's own interview, there's no such thing as society. She was saying that there essentially was a thing as society, and not just that government has a role to address and intervene in injustices. But how much time has she got to address to this great reforming plan? There was lots of words. There wasn't a great deal of policy. We're expecting more speeches on this. But all the while, she has that Brexit plan that she has to come up with. And at the moment, sterling's falling. And when she was addressing that, she did say something interesting about Brexit and reflecting on the market reaction to her interview with Sophie Ridge yesterday. She said, she was asked whether the markets were getting it wrong. Sterling has fallen because it sees the likelihood of us leaving the single market as higher. She said the people who are getting it wrong are those who say it's inevitable there'll be a hard Brexit. Certainly a few gasps from the press crowd in the audience that she'd said something relatively new. It was clarified afterwards that even that wasn't new. She's saying that she doesn't accept the term hard and soft Brexit, which is something that she said before. So you have to look very carefully to find new words from the Prime Minister. She's setting out her kind of philosophy to govern the next few weeks of speeches on the domestic agenda as we wait for the Brexit plan.
Faisal, thanks a lot. We're going to shift tack and tell you more about those claims by the Red Cross that the NHS is in a humanitarian crisis. Both the Health Secretary and the Prime Minister have rejected that claim, but admitted that the Health Service is facing a tough time. Joining us now from Central London is the Joint Chair of the British Medical Association's Junior Doctor Committee. That's Jeeves Vijayasuriya. Jeeves, welcome to you. We had Jeremy Hunt on this morning, and he was saying, actually, however bad things may seem this year, they're actually better than last year, which at first blush actually, and you'll know far better than someone like me, but at first blush feels true. Last winter we were talking about emergency conditions at certain hospitals. I don't think we had a flu outbreak, but it felt worse last year than this.
I think the sad reality is that actually pressure now is worse than we've ever seen. The Society of Acute Medicine said only days ago that this January may well be the worst January we've seen in the history of the NHS. Actually, for frontline staff who are on the ground, the reality that we're seeing is patients waiting huge amounts of time to be seen and real congestion in our hospitals all the way through the system, not just in A&E, but all the way through. And the reality of this is so devastating for those patients who are suffering the consequences of poor management from the government.
Well, he says, without using that phrase, poor management, he does indicate, well, actually more than indicate, he's pretty explicit about it. He says it's patchy. You know, there are some trusts who do far better than others. And in that sense, it's not a question of cash, it's a question of leadership and management, isn't it?
I think the sad reality is that we are seeing problems from start to finish right through the systems, and that's not just in A&Es. That's the funding and resources and staffing that we require at GP level, all the way through the emergency departments, and right through to the support that's required in social care. The reality is that there is ever increasing demand and a winter period that the impact of which grows ever longer right through this 6 months of the year. And that is absolutely devastating for patients and their families who are suffering the consequences of that lack of not just funding, but resources and support.
You mentioned demand, so did Jeremy Hunt this morning when we had him on Sky, and I dare say he'll probably make the point again in the next hour when he appears in the House of Commons. But the point he made this morning, you'll be familiar with it, I'm sure, is that over the next 5 years, the NHS will treat 1 million more patients over 65, another 1 million more people will turn 65, with all the potential compound medical conditions that oftentimes entails. I mean, there is this inescapable demographic fact, which wonderfully we're all living longer, but that comes at a cost.
We absolutely are facing new and changing challenges with changing demographics of patients. But that is not an excuse for delivering substandard care and not adequately funding or dealing with the staffing and recruitment crises that we are facing. The sad reality is the political choices that are being made now are such that those problems will only grow worse, and our ability to cope with things like the winter pressure are growing much, much more difficult. And that is where we really need the government not only to stop hiding the failure of the system, but also to start to really address the problems that we have. Ultimately, we have a healthcare system and frontline staff that are doing the absolute best they can with the little resource that they actually have. And we need to confront that fact and start to address it to really start to be able to find solutions for patients.
Well, you know, we've got the Red Cross talking about a humanitarian crisis in the NHS, Red Cross, which you normally hear talking about crises affecting other parts of the world. I mention that because there are those people who feel that the solution, you mentioned resources, that the resource solution, the most obvious one, is actually to look to that £13 billion foreign aid budget, 0.7% of GDP. And given that we've got a crisis in our own country, let's start spending some of that money over here. Would you support that?
I think the very sad reality is that we need a government that values the NHS and that starts to fund it appropriately. For far too long, we have ignored the problems that we have.
What is that appropriate?
And I think what we really need to do is start to look at that route to tip, and that's not just healthcare. That's issues around social care and the problems that we have there. Yeah. Fundamentally, we are struggling.
Jeeves, my point is, you're asking for money, and I'm asking you how we get that money. Is it by putting a penny on income tax? Is it by raiding that foreign affairs, foreign aid budget? It's easy to make the demands, but it's the politicians who've got to solve the crisis with cash. And where do they get that cash from?
I think we need to start to look at the percentage of GDP that we spend on our health service. The reality is that compared to the rest of Europe and compared to other healthcare systems, we massively underinvest in our healthcare system. And actually, that should be something we prioritize. The health of the nation and the health of the average person is not something we should undervalue. That's something we need to make a priority. Right now, we are in the midst of an absolute crisis this winter. And that is where we need not just the short-term influx of resources and funding to be able to cope with that, but a real plan about what we're going to do moving forwards to solve the problems yet to come. The sad reality is that for so many staff that are stretched to breaking point is that this is actually only just the beginning of that process. This is only the beginning of what we're seeing.
Jeeves Wijesuria from the BMA, thanks very much indeed. Thanks a lot.
Theresa May has dismissed the NHS winter crisis as not unusual, saying there are always extra pressures for the NHS over winter. During a speech in central London, the Prime Minister also unveiled a package of reforms aimed at helping to end the stigma surrounding mental health and also help ensure children and young people get the help they need. Adele Hanlon's son has serious disabilities and mental health issues, meaning he needs round-the-clock care. However, she's forced to travel 300 miles each way to see him, after being told there's only one hospital in the country that could look after him. She's travelled from Bristol to Newcastle this morning, and we can speak to her now. Thanks very much for being with us, Adele. Just take us through your situation, your circumstances. You have to perform a round trip of hundreds of miles just to go and see your son. Why is that?
Because there's no provision locally, so we have no option other than to fly to Newcastle.
When you say, Adele, that there is no provision locally, is it that there is no hospital, no facility with the correct care for your son? Or is it the case that there are those facilities, but there aren't the places within them?
I believe due to all the cuts that have been made over the years, the provisions have slowly closed down. So our situation is there's no provision that would take Eddie's complex needs close to home, and this is the next nearest provision to Bristol, where we live.
Tell us a little bit about Eddie, if you can.
Oh, Eddie's a lovely young man, but unfortunately he does have some very complex needs: bipolar, epilepsy, ADHD, autism, a huge range of other things amongst that. But all in all, he's a very charming young man. We just want to be with him and have him closer to home and help with his care.
A charming young man he sounds like, but one with complex needs. We've heard from the Prime Minister today that she wants to remove the stigma surrounding mental health or problems with mental health. She wants to improve mental health care provision for young people. Hearing those words, how does that make you feel?
I hope she can improve things for children and young people with mental health. I hope she can look at early intervention as well as actually putting money into the services and just taking a fresh look at it. It's dire. We shouldn't have to be travelling this far.
So what is, in your mind, the problem? Is it simply a lack of money to provide those resources that you and many others need?
There's no funding for community placements. There's nothing available in the budget to have people closer to home, and it becomes, rather than being a health issue, it becomes a social care issue. When funding is in the picture, there's no money in local authorities. There's nothing, and if they've got no money, they can't bring your child back. They can't provide anything for them. It's a very difficult situation.
And then you find yourself, and so you and others like you find yourself in the situation of having to spend money to take a trip that lasts, several hours every time that you do it. You can't see your son as regularly as you would like, I would assume.
Absolutely. Financially, we're quite fortunate. We do get most of our travel provided for us, but there are hundreds of other families who also are in the same predicament and aren't as lucky as us. It's ridiculous. I can't put into words how hard it is to only be able to see your child once a month. The distance is awful.
So just on that point, what is, given you clearly are aware of others with shared experience, I mean, how many other people do you know of who are suffering in the same way that you are, who will be listening to the Prime Minister today suggesting that, things will get better and crossing their fingers and hoping that will be the case?
I'm really sorry I didn't hear that.
Oh, sorry, Adele. You clearly know of other people who are in the same situation as yourself. I'm just wondering how common a problem it is for people to have to travel distances to see their children in residential mental health care.
It is a very common problem because at the time when a child's in crisis and they need a bed, they can't wait for one to become locally. So quite often they're literally placed wherever there is a bed. So many beds are also being blocked. So, local authorities can't afford to take the children back to where they live. It's a little bit like a circle, and no one's getting out of it and no one's getting the help that they need.
And just as we draw this to a close, just a word on the care that Eddie does receive where you are in Newcastle.
I'm really sorry I didn't hear that.
Can you just tell us a little bit, Adele, about the quality of the care that Eddie is receiving where you are? Despite the fact you have to travel hundreds of miles, what is it like for him in Newcastle?
If I could pick the hospital up and move it closer to my house, I would. The staff and the care is amazing. But I have to say, we have been on the other side of that. He has been in another hospital where he was actually moved for his own safety. So we've seen both sides. We're very fortunate. Newcastle, St Nicholas Hospital is amazing. They're very, very good with the children. Very, very well trained.
Adele, thank you very much for joining us. That's Adele Hanlon and her experiences of mental health care provision within the NHS for her child. Well, let's speak now to Dr. Youssef El-Gingi, a GP and also author of How to Dismantle the NHS in 10 Easy Steps. Dr. Youssef, thanks very much for being with us once again on Sky News. I hope you managed to hear just some of that interview that we had there with Adele. I mean, how common a problem in your experience is that? Your patients looking for mental health care for their children locally, but having to travel some distance to find it?
I mean, I don't know so much about my personal experiences with patients, but we know that this is the picture of psychiatric and mental health services across the country, that this was a program that, of course, started in the 80s of delivering care in the community, shutting and closing lots of psychiatric hospitals and facilities. And, of course, the investment wasn't put into the community or into GP services. And tragically and appallingly for patients with serious mental illnesses or with significant needs, they're unable to get those needs. And the number of psychiatric beds, for example, or inpatient beds are very limited. And you have this terrible situation where, as we've just heard, patients and sometimes children have to travel hundreds of miles. And of course, that means their families and relatives in order to access that care. And that program is now being transplanted for physical health. So we're seeing the same plans in the STPs, Sustainability and Transformation Plans, aim to do the same thing with normal routine care for physical health, not just mental health.
Theresa May undoubtedly would have wanted today the focus to have been on this move to try and have parity of care when it comes to physical and mental conditions. However, once again, it has gone back to those comments from the British Red Cross that the NHS is suffering a humanitarian crisis. Jeremy Hunt, Theresa May don't recognise that characterisation. Do you?
Absolutely, I do. And it's incredibly dismissive and blasé for them to pretend that there isn't a crisis. But there's a fair point there, which is that the plan, this is actually all going according to plan. These are deliberate policies. It's the government's own policies that the NHS will have endured something like £40 billion of cuts by the end of this decade. It's also the government's plan, although they haven't been frank with the public, to privatise the NHS, and that's accelerating. We've seen a Privatisation Act in the last Parliament, which has opened up the NHS to more and more outsourcing and tendering of contracts to the private sector. And this is the key point, beyond the fact that the plan is to introduce private health insurance, increasingly to expand that so that we have a two-tier system. Beyond that, the issue here isn't just that we need more funding for the NHS. The issue is that we have to remove market forces, the market system and the private sector from the NHS because it is more expensive. It is currently siphoning off billions of pounds. Which should be spent on patient care. Those are being siphoned off, in fact, tens of billions of pounds as corporate profits.
Problem, though, within the NHS at the moment, you must concede. The model as it stands doesn't work. The government have tried moving the money around the health service to try and better provide. That hasn't worked. Isn't it about time that we actually have to, bite the bullet and face the facts that we have to consider another model, and that model may well include more privatisation?
Well, I completely reject that, I'm afraid, because the model that exists, this is the key point, I'm glad you've mentioned it, is not the original model of the NHS. It is no longer a publicly provided, publicly run, publicly accountable system. It is a market system which is increasingly privatised. We have hospitals now run as businesses which are privately financed and run by corporations. They're paying up to £80 billion will eventually be paid to big banks, financial firms, corporations for their mortgages over the coming years. That's the current situation with the NHS. We're seeing billions of pounds being spent on tendering of contracts, outsourcing of contracts. We're seeing millions of pounds being spent on procedures, operations that aren't even being carried out sometimes by private companies or have to be repeated. If you ask, for example, the Royal College of Radiologists on this point with MRI scans, we've seen that we've had 30 years of marketising and privatising the NHS. That is the main problem. Until we do, as Jeremy Corbyn suggested, and as the Labour leadership policy is, which is to adopt the NHS reinstatement bill and restore the NHS as a publicly run and provided system, then the NHS is going to continue being in this crisis, is going to continue being privatised and lurch from one crisis to the next.
Dr. Yousuf El-Ghaigi, thanks again for joining us here on Sky News.
I've been getting